Question number 41. Drugs highly bound to the albumin. Option A, NSAIDs. Option B, lidocaine. Option C, beta blocker. Option D, verapamil. Note: the answer for this is option A, NSAIDs. Explanations. Now, this is a concept from the volume of distribution, which comes under the distribution part of the pharmacokinetics. Now, please remember here albumin is a plasma protein. Now, let's talk about volume of distribution. Volume of distribution depends on lipid solubility and plasma protein binding capacity of the drug. The drugs which are lipid soluble, they cross the blood vessel wall, so they have high volume of distribution. Likewise, drugs highly bound to the plasma proteins, they stay in the blood, so they have low volume of distribution. This is a box showing drugs highly bound to the plasma protein: to albumin, barbiturates, benzodiazepines, NSAIDs, valproic acid, phenytoin, penicillins, sulfonamides, tetracyclines, tolbutamide, and warfarin. And acidic drugs usually bind with the plasma albumin. Now, the basic drugs usually bind with the alpha-1 acid glycoproteins, which include beta blockers, bupivacaine, lidocaine, disopyramide, imipramine, methadone, prazosin, quinidine, and verapamil. And what is the clinical importance of plasma protein binding? Effect on duration of action. Drugs with the high plasma protein binding are usually long acting. And distribution. High plasma protein binding drugs stay in the plasma, thus have low volume of distribution. And displacement. High plasma protein binding drug can be displaced by another highly bound drug. And dialysis. Dialysis is not effective for drugs having the high plasma protein binding. Now, volume of distribution is calculated by dose of the drug administered IV by plasma concentration attained. Now, higher dose, the drugs which are having high volume of distribution, they remains in the tissues mostly and less in the blood plasma. So higher dose has to be administered to attain the same plasma concentration for drugs having high volume of distribution than those with low VD. This high dose is called the loading dose. VD is the main determinant of the loading dose. The chloroquine has the highest VD. Loading dose, the concept is mainly for the drugs with low volume of distribution.